So, when we identify areas of misalignment or subluxation in the low back and the pelvis, again, that's normally the common cause and culprit of lower back pain. So the way that we fix those areas is by getting them checked and adjusted. So normally an adjustment in our office, patient lies prone on a table, and we assess what's going on with the spine, the muscles, the discs, the ligaments, the nervous system by visualizing, seeing areas of torsion, tension, or stress, and we palpate, we feel for tight muscles, swelling and inflammation, and movement and motion, and we're able to find and identify exactly where the problem lies. So in the pelvis, you've got 2 SI joints, and then you've got 5 joints and discs in the lower back or the lumbar spine. Usually if one of those areas is torqued, twisted, or misaligned, that's where low back pain is coming from. And again, that can be from commuting time, time at a desk, manual labor, or just keeping up with your kiddos. So once we've identified an area of subluxation, we adjust. These tables are called drop tables. So those misalignments in that pelvis, gently drop and adjust, gently set that joint back in place, get it moving properly again so it can heal. And after we check the pelvis, we take a look at the lumbar spine or the lower back. And again, perfect. And by getting those joints moving again, it gives the body the best ability to heal in whatever area is misaligned. Movement is life. When things are moving properly, that's when the body can heal. That's when we can get you out of pain.